Hi, you guys. Welcome back to my channel. My name is Jennifer, and I wanted to do a video today about blood sugar issues after weight loss surgery. Now, I personally had VSG surgery about 4 years ago, and at that time I was 261 pounds. 11 months ago, I did have revision surgery from VSG to gastric bypass Roux-en-Y due to really severe acid reflux. At that time, I was 175 pounds, and today I'm 160 pounds at 11 months post-op. So I have been very successful with weight loss surgery, and now that I'm a gastric bypass patient, I'm actually now experiencing some new things that I did not experience as a VSG patient, or I'm experiencing them to a stronger degree than I did prior. Now, I did have blood sugar issues prior to surgery, and I think a lot of people that have had surgery due to obesity because of poor eating habits or whatever the case may be. So a lot of us have had this challenge before now, but not everybody has. And so in my life, I've got my daughter and my brother who both are also gastric bypass patients, and they never had any blood sugar issues until now. So I want to talk about some things so that if you ever do experience these things, you'll know what they are, you can kind of identify them, and they might just not be quite so scary because quite honestly, they can seem very scary. They can be very alarming symptoms. So I'm going to talk about two different things today. I'm going to talk about high blood sugar, and which is actually a lot more common, I would say, high blood sugar after gastric bypass or any of the more complex surgeries, I would say. Now, or what I would presume. Now, the one that is scarier, in my personal opinion, is low blood sugar. Now, low blood sugar can come in varying degrees. It could just be a little bit on the low side, which, isn't a huge, you might not even realize you're experiencing it. What I'm talking about is a little bit more distinctive and profound. It is called late onset dumping syndrome. It's also called reactive hypoglycemia or delayed dumping syndrome. It's kind of got those three different names. What happens with our bodies is, and this can happen to anybody. This is not specific to weight loss surgery patients, but that is what I'm experiencing it now. So what happens, especially for me personally, now everything I talk about is my personal experience. I'm not trying to give any medical advice. Please seek your medical provider for additional information or advice about these topics I'm talking about, but this is my personal experience. So what I have found is if I've gone a long period without eating anything, and then I eat something that is either a little bit higher in carb or has kind of a little bit more sweet with a little bit less of a protein component to whatever it is I've eaten, I can experience a very, very significant drop in my blood sugar. So let me give you a couple examples. So the most profound and alarming episode that I have had just happened a couple weeks ago, enough to where I brought it to my doctor and I did receive a diagnosis of reactive hypoglycemia. And it was a little bit scary. It was definitely scary for me. So what happened was I woke up in the morning. It was a Saturday morning. This is 2 weeks ago. I had made my normal collagen cocoa, which is just collagen powder mixed with water, mixed with a little bit of sugar-free flavored syrup, which happened to be salted caramel that day, and some fat-free half and half. And so that's what that is my collagen cocoa that I have every single morning. Now, instead of really having, I don't often eat breakfast, to be completely honest, but that day it was a Saturday morning, and so I ended up having some honey bunches of oats. I had a serving size of about 3/4 of a cup, and we were out of milk, and so I had some fat-free half and half mixed in it. And I ate that, and because I'm a year post-op, I'm able to eat pretty fast. So I just ate it like a normal person. I didn't delay. I just ate it. And it was actually, I had no problem, with that, tolerating that. However, about an hour later, I had a extreme sudden onset of a hypoglycemic episode. Now, what that feels like, what it felt like for me, is a sudden feeling of just like all the energy just gets sucked away. It's just gone. I felt a feeling of heart palpitations. My heart was racing. I felt a very like severe brain fog to the point of almost like a euphoric feeling where I felt kind of disconnected from my body. So it's like my limbs felt very heavy. I was extraordinarily uncomfortable, and I wasn't I don't feel like I was really thinking, very straight, very discombobulated, and very significant symptoms. I just so happened to have my blood glucose monitor sitting right next to me. And so I opted to test my blood sugar. And so it was 49. Now 49, to give you some reference to what that means. So usually when I test my blood sugar tends to be in the 70s, low 80s. That's common for me. So 49 for anybody testing their blood sugar and it's 49, that is extremely, extremely low. So that is what classifies this as being reactive hypoglycemia. This was a definite hypoglycemic episode, but it was reacting to the fact that I had just eaten. It wasn't a random occurrence. So what I did for myself is I was able to get up. I got I got a cheese stick, ate that. I also grabbed a protein shake and started sipping on that. And so my blood sugar started to come back up. Now, though it is very, very alarming, if you're not able to do anything about it, it will go away. Our body will balance out. Now, if you're having this a lot, like many, many times, like in a week, for instance, then you definitely want to seek some medical advice and some medical care, because you might have something else going on. Now, on the opposite of having low blood sugar or late onset dumping syndrome, you might have high blood sugar. Now, if you've never experienced high blood sugar, that's some pretty distinctive symptoms as well. But the difference is, and let me back up. Late onset dumping can actually happen, or let me rephrase that. Reactive hypoglycemia can happen anywhere from 30 minutes to up to 3 hours after you've eaten a meal. So high blood sugar, on the other hand, is where you eat something that's a little bit higher in carbs, and maybe 20-30 minutes later, or up to even 2 hours apparently, you could start having a sensation where you feel all of a sudden very warm. You get maybe heart palpitations. You might get a little, a little mild version of a little bit of brain fog. The most significant sensation that I get is just a feeling of being uncomfortable, being antsy, being feeling like pent up energy, and I get fidgety. That's kind of one of my tells. Is I get fidgety and I'm uncomfortable. I start standing up and rearranging the pillows on the couch, or I start going to the kitchen and just messing around, like cleaning the kitchen or doing something, because it's this pent up energy feeling. Sometimes prior to having surgery, it would actually cause extreme drowsiness, where I would kind of almost pass out on the couch because of having this high blood sugar episode. But it could be a little bit scary to have these sensations, but it's just important to know that they will pass. They're very short term. They will pass. If you're having them consistently, like I said, whether it's high blood sugar or low blood sugar, please seek the medical advice of your doctor. You might have something else going on. Just because we've had weight loss surgery doesn't mean that we can't still get type 2 diabetes. One of the issues I'm having right now is my A1C, which is that's the test. It is a 3-month average of our blood sugar levels. And I actually have got a high A1C right now. Well, let me rephrase that. A higher than usual that for myself blood sugar. So it's actually classified me now as being pre-diabetic. So that's really concerning. And the fact that I'm also having this reactive hypoglycemia at the same time. So what's happening is my blood sugars are going higher than usual, but then they're dropping really, really fast and really hard. And so I really need to check in with my doctor, find out what we need to do about this. Her initial advice is to have protein with every single meal. That is something that I've been trying to incorporate. So that's kind of what I want to talk about today. I would love for you to give me down below, put some messages about if you've had this episode, what you did to resolve it, in order to kind of help other people that maybe haven't. For me personally, like I said, I was grabbing a cheese stick. It was grabbing, sipping on a mocha latte shake. For having the low blood sugar. For the high blood sugar, I literally just wait that out, or I walk around the kitchen. I try to use up the energy. So I hope that was helpful. I'm going to be doing a couple more videos in the next couple days because I have a lot on my mind I want to share with you. And I guess that's it. I hope you guys have a great day, and I'll see you at my next video. Bye now.